So good afternoon, everyone. So I would like to welcome you all to another wonderful session from Let's Update Language Academy for OET Reading module. Okay, so let's just wait for a few minutes for more people to join in, and then we'll begin shortly. Okay, so let me introduce myself. I'm Pooja Vijaykumar, and I am here to give you an insight for OET reading module part C. So now, yes, I can see many of you joining in. So yes, good morning. Yeah, good afternoon, Anjana, and yes, hello, Shruti, Parvur, Satish, and yes, good afternoon, Priyamu. Good afternoon, Yasir Mohammed. Okay, so yes, I can see your wishes here. Okay, so now we shall begin the discussion. So as you can see on the screen, that is for those of you who are attempting for the first time. I would like to give you some general information about the reading subtest. That the reading subtest is basically divided into three parts. There is part A, part B, and part and you will have a total of 42 questions, and part A consisting of 20 questions, part B consisting of 6 questions, and part C consisting of a total of 16 questions. Okay, and regarding the time duration that will be allotted to you, you will have a total of 60 minutes or 1 hour to solve the entire reading subtest, of which part A will be allotted 15 minutes and part B and C 45 minutes. Okay, so you need to complete it during this allotted. And so let's come to part C, because we are going to have a discussion of part C module. And basically, part C, this assesses your ability to identify the detailed meaning and opinion okay, in two different texts. Okay, and it will be a long text, okay, about 800 words, okay, consisting of about 800 words, okay. So that's two long text, and those texts will be followed by a set of questions, okay. So a set of 8 questions each, okay, so a total of 16 questions, okay. And the nature of topics would be, it would be something related to healthcare, okay, or medical field, okay. And topics of interest to healthcare professionals, okay. So these are the topics or research topics, okay. These are the kind of information or topics that you can find in part C. Okay, so now moving to, yeah, the number of or the nature of questions, okay. So as I told you, you will have 16 questions in total from part C section, of which you will have uh, options or choices for each question, okay. So you will have 4 options or 4 choices for each question, okay? And you have to choose the most appropriate answer. And moving to, yeah, how to approach part C, that is, you need to read the question first to know what information you need to find, then read the content of the text, okay. Content of the text in the sense of the paragraph, okay, where the information probably is. So you need to read it, and then when you read it, your agenda, your aim should be to find the answer to the question that you have just read, okay. And read the answer options, that is, you will have 4 options, and then decide and choose the most appropriate. Okay. So this is the approach that you adopt to track part C. Okay. And usually the order is such that the first question will be from the first paragraph, second from the second paragraph. Okay, so that will be the order. Okay, so now, yes, I can see more of you joining in. Yes, good afternoon, Shamib, Abdul Aziz, and hello, Anjana, and good afternoon, Jisna Deepu, and good afternoon, Regina Shafiq. Yes, and okay, there is a little more information that I need to give you about Part C. So the texts in Part C are opinionated. Okay, so they may include the writer's opinions also, and also the opinions of the others who have also completed the research on the same topic. Okay, so that is some information that you can expect in Part C. Okay, and the opinions may agree or disagree with each other. Okay, because the writer's opinion may disagree with the other researchers who have done the research on the same topic. Okay, so that will be mentioned. Okay, the author's opinion or the narrator's or the writer's opinion will be mentioned, as well as the opinions of the others, and they may agree or disagree with each other. But that's totally okay. And the opinions can be explicit. That means uh, explicit in the sense it would be stated clearly and in detail. Okay, so example like he agrees to this, he disagrees to it. Okay, so that means it is stated clearly. So you will get an idea. Okay, so that means he agrees to a certain point, or he disagrees to whatever is happening there, or to a certain point. Okay, so that means the opinions are explicit. Okay, that is stated very clearly. And also they can also be implicit in nature means it is not directly stated or expressed, okay, but it's hinted or suggested, okay, and can be understood when you read it. Okay, so that is what you mean by implicit. So the opinions can also be implicit in nature. Okay, that means not directly mentioned, like okay, this is his opinion, or he agrees with or disagrees, but you can just understand because it would be hinted or suggested somewhere, like okay, when you read it you'll quite understand. Okay, but it's not directly mentioned, right? So that is what you say implicit in it. Okay, and several of the questions in part C require you to demonstrate your understanding of the writer's opinions and the line of argument. Okay, so it actually assesses your ability to understand. Okay, what you read. Okay, so that is your understanding of what is written there. Okay, about the attitude or tone of the author. Okay, or what does he express. Okay, or what is he trying to say. Okay, he agrees or disagrees, or he's unhappy with that, or he's happy with that, he's optimistic with that, he's positive about that. Okay, so yeah, overtly optimistic about something. Okay, eager about something, or he is like not at all happy with something. Okay, he says that's unfortunate, or he is like gloomy or pessimistic about something. Okay, so all this kind of tones and attitude, okay, will be hinted over there, and it's up to you to understand that. Okay, and then you need to answer the full questions that for. Okay, and you can comprehend this by focusing on like the tone or the attitude of the author. You can comprehend that or understand that by focusing on the overall meaning of what they are communicating. Okay, so because usually the tone or attitude of the author will be expressed in the very first paragraph and the very last paragraph. Okay, so when you just go through it, you will get an idea. Okay, so when he starts off, okay, what is his tone attitude? Okay, he's pessimistic or optimistic about something, or positive or negative about something that is going to happen or will happen or that has been happening. Okay, so you will get an idea when you read the first paragraph and towards the last paragraph. Yes, and towards like when you read the entire text, you definitely will get an idea, but usually these kinds of thoughts or tones or attitudes are expressed towards the beginning and towards the end. Okay, so yes, so that's about it. So that is some information that I needed to share with you. Okay, so now we shall have the discussion of a part C module now. Right. So this is part C module, and usually the format is such that the whole text will be there, and then the questions, the 8 questions follow after the entire text. Okay. So for your convenience, okay, because you need to see the question as well as the paragraph at the same time, I have restructured it in such a way that you can see that. Okay, so I have put the first question after the first paragraph, second after the second paragraph, and so on, so that it would be easier for you to locate the answers. Okay, so I want this to be interactive. I want you to equally participate with me, and you can put your choice of answers in the comment section, please. Okay, okay, so as you can see on the screen, you can see the very first paragraph and the question. The question is, what do we learn about sports injuries in the first paragraph? So that is the question. I hope this is visible to you, okay, and clear to you. Okay, if you want, I can just zoom it, okay, more, but then I think this is visible, right? I can just zoom it a little bit more. Right. So what you can see on the screen is the first paragraph followed by the first question. So the question is, what do we learn about sports injuries in the first paragraph? So I'll give you a minute to read the paragraph. Okay, the very first paragraph, as you can see, and then we'll discuss the answers. Okay. And please put in your choice of answers in the comment section, please. Okay, so I can see answers coming up already. And yes, good afternoon, Liju K. Nair. And yes, Jinsi Alex Binny has answered D. Jisna Deepu has answered D. Okay. And what about the rest of you? Shruti Parvur Satish has put in D. Liju Nishan Matthew has put in B as answer. Okay, so let's read the paragraph now. Although sports injuries to the knee, ankle, and shoulder have been well documented, injuries to the pelvis, hip, and thigh get little attention because of their low prevalence. Unfortunately, severe consequences may result if these injuries are improperly. So, what do we learn about sports injuries in the first paragraph is a question, and the options are A. Some sports injuries have severe consequences for subsequent sporting careers. B. Improper injury management has been well documented. C. Low frequency pelvis, hip, and thigh injuries are more difficult to treat. And D. There is more information available for some type of injuries than for others. Okay. Jenny Franny has put in B as answer. Okay, so let me just give you the answer. So the correct answer is D. Uh, so yes, so congrats to all those who have answered D. Okay, because that is the correct answer. I'll just highlight the answer and then I'll give you the explanation. So, because what is mentioned here is sports injuries to the knee, ankle, and shoulder have been well documented. Well documented in the sense there have been quite a lot of information that has been documented about those three injuries, like knee, ankle, and shoulder. Okay, but the injuries to the pelvis, hip, and thigh get little attention. Okay, that means that has not been well documented or probably much information is not available. Okay, because of whatever reason as they have told. Okay, so basically what they have hinted is that there is more information for some type of injuries like knee, ankle, and shoulder than for the other injuries like pelvis, hip, and thigh. Okay, so that is what is hinted here, right? And because of which your answer should be D, option D. I'll just highlight the answer in the paragraph also, as you can see. Okay, so now moving to the next paragraph and the next question. I hope this is visible to you. So I just want you to see the paragraph and the question and the options at the same time. Yeah, almost okay. Right. Okay, so I'll just tell you the question, that is, when do stress fractures happen? Okay, and this is a paragraph that you need to read in order to find the answer to this question. So I'll give you a minute to read the paragraph and then we'll discuss it. Okay, Okay, so I can see answers coming up already. Okay, so we'll read the paragraph together. So, yes, femoral neck stress fractures were mainly seen in military recruits due to a triad of activity that is new, strenuous, and highly repetitive. However, as a result of self imposed fitness regimes of recreational athletes, over the last 20 years, the number of these injuries has been increasing in non military populations. In contrast, contact sports such as football, rugby, and soccer are usually the cause of most fractures of the hip. Stress fractures occur in normal bone undergoing repeated submaximal stress. As the bone attempts to remodel, osteoclastic activity occurs at a greater rate than osteoblastic activity. When these cumulative forces exceed the structural strength of the bone, fractures happen or occur. Stress fractures occur mainly in the femoral neck and are classified as either tension, superior aspect of the femoral neck, or compression, the inferior aspect of the femoral neck. So that was what the paragraph was about, and the question was, when do stress fractures happen? And the options are: option A, they happen in specific situations; B, they often occur when athletes leave military service; C, they often happen following abnormal osteoclastic activity; and option D, when bones cannot remodel to deal with contact sports injuries. What do you think is the answer? Please give in your choice of answers in the comment section in Facebook. Okay, so yes. Okay, so let me tell you the answer then. I think I can see few of you responding with D. Any other choice of answers? Okay, so let me tell you the answer. Yeah, I can see Priyanka Alex responding with C. Yes, and I want more of you to participate, and let's see what your choices of answers are. Okay, so let me give you the answer for this question. The answer is A. They happen in specific situations. Okay, and just highlight the answer and also give you the reason for this being the answer. Right. So actually, here, yes, where is this information? When do stress fractures happen? That is a question, and where is this information mentioned? See, what they have mentioned is stress fractures, as you can see towards the mid, okay, it occurs in normal bone undergoing repeated submaximal stress as the bone attempts to remodel. Osteoclastic activity occurs at a greater rate than osteoblastic activity when these cumulative forces exceed the structural strength of the bone, and that is when stress fracture. Okay, when these cumulative forces exceed the structural strength of the bone, is when the structures. Okay, so they are asking when does it happen? Yes, this happen in specific situations. What are the specific situations? That is when the cumulative forces exceed the structural strength of the bone. That is when it happens. Okay, and you can eliminate B, C, and D because in B, what have they mentioned? They often occur when athletes leave military service. No, it's not when they leave it. Okay, like when they are doing or they are in the service. Okay, it could happen. Okay, because of the kind of activities they do, but not when they leave it. Okay, leave the service. And what about C? If they often happen following abnormal osteoclastic activity. No, it's not because of osteoclastic activity or its abnormality or the rate at which it was happening. It's only when the cumulative force exceed the structural strength of the bone. When that is exceeded, only then this happens. Okay, not just because of osteoclastic activity alone. Okay, and what about D? When bones cannot remodel to deal with contact sports injuries. Okay, that is option B. Okay, that means that is also not specified like that. Okay, that bones cannot remodel to deal with all that, that is not mentioned. Okay, but you can give a general answer like they happen in specific situation in the sense when it exceeds, when the forces exceed the structural strength of the bone, and that is when the fracture happens. Okay, so that is the correct answer. And yeah, so now moving on to the next question. Right. The question is, according to the third paragraph, which of the following statement is not true? Okay, and this is the paragraph that you can see on the screen. I hope this is visible to you. Right. And I'll give you a minute to read this and then we'll discuss together. Okay, so let's read together. So that is hip fractures are classified as intracapsular, which includes femoral head and neck fractures, or extracapsular, which includes trochanteric or introchanteric and subtrochanteric fractures. The location of the fracture and the amount of angulation and the combination play integral roles in the overall mobility of the patient, as does the pre-existing physical condition of the individual. Fractures of the proximal femur are extremely rare in young athletes and are usually caused by high energy motor vehicle accidents or significant trauma during athletic activity. Other causes may be an underlying disease process such as Gaucher disease, fibrous dysplasia, or bone. Okay, so that was what the paragraph was about, and the question is, according to the third paragraph, which of the following is not true? Whenever you see something they are asking like not true, you need to find something that is not true, not mentioned, false, or incorrect. So in that case, just underline or highlight or just circle the word. Okay, because at the end of reading it, you should not come up with an answer of what is mentioned. Okay, because our aim is to find which is not true or not mentioned. Okay, so just highlight that part, and then the options are: the exact position of the fracture is relevant for subsequent treatment. B. A patient's state of health can play a role in the severity and complexity of fractures. Option C. High energy athletic accidents can exacerbate hip fracture. Option D. The angle of any distortion is an important. What do you think is the answer? I can see answers coming up. Yeah, I can see Bindu Kurian responding with B, Rahul Raj responding with C, Jinsi Alex Vinny responding with C. What about the rest of you? Shinju Prasad responding with C, Priyanka Alex responding with D. Okay, they are asking about what is not true, okay, or not mentioned. Okay, so three of the answers are mentioned true as per the paragraph. You can see. So they are asking for something that is not. Okay, so let's look at this. So look at option A. The exact position of the fracture is relevant for subsequent treatment. Okay, is that mentioned? What do you think? The exact position. Yes, definitely it is mentioned, because the location of the fracture is mentioned. Okay, and play integral roles. That is what they say. Okay, so definitely the exact position of the fracture is relevant. So option A is true, is mentioned. And look at option B. A patient's state of health can play a role in the severity and complexity of fracture. State of health in the sense their existing or pre-existing physical condition. That is also relevant or important in assessing, yeah, or it will play a role in the severity and complexity. So option B is also mentioned, the pre-existing physical condition of the. Okay, and what about option C? High energy athletic accidents can exacerbate hip fractures. Is that mentioned? Okay, let's look at that. Look at option D. The angle of any distortion is an important angle. About the angle, yes. The amount of angulation, just highlight that. It will also play an integral role. So option A, B, and D is mentioned. And option C is incorrect. That is, high energy athletic accidents can exacerbate or hip fracture. What is mentioned here is fractures of the proximal femur are extremely rare in young athletes and are usually caused by high energy motor vehicle accidents. Okay, not athletic. Okay, because in young athletes they are saying that it is extremely rare. Okay, so what they are mentioning it is high energy motor vehicle accidents, not athletic. Okay, so and that is why C is. So the correct answer for this question, just highlight in a different color, is. So this is the statement that is not mentioned in this paragraph? I hope that is clear to you. Okay, so moving to the next paragraph and the next question. Right, I hope this is visible to you. So, why is avian more common in younger patients? And this is the paragraph. I'll give you a minute to read it and then we'll discuss it together. Okay, so you can see answers coming in. Yes, Priyanka Alex has responded with option C as answer. Chinju Prasad has also responded with C. Why is avian more common in younger patients? Is the question. So Jinsi Alex Penny has responded with C. Shruti Parvur Satish has responded with C. Rahul Raj has responded with C. Chinju Prasad has responded with B. Okay. Yeah. Yes, I want more of you to participate. Okay, I'll read out your answers. Okay, so let's read this. So, identification and initiation of treatment is imperative in attempts to avoid complications such as vascular necrosis. AVN is more common in patients in the pediatric and adolescent age group. This outcome is due to the precarious nature of the blood supply to the subchondral region of the femoral head, which does not stabilize until years after skeletal maturity, after which collateral flow develops. Okay, so that is what the paragraph was about. And the question is, why is avian more common in younger patients? And the options are A, because treatment initiation usually takes longer in young patient. B, because blood supply does not become stable until later in life. C, because skeletal maturity can hinder blood flow. And option D, because collateral flow is infrequent during adolescence. So that was what the options were. Okay, so let me tell you the correct answer. The correct answer is option B. So congrats to those who have answered B. Okay, so because blood supply does not become stable until later in. Okay, and why is B the correct answer? Okay, because they are saying this, AVN is more common in patients with the pediatric and adolescent age group. That means the younger patients, right? And this outcome is due to the precarious nature of the blood supply to the subchondral region of the femoral head, which does not stabilize until years after skeletal maturity. That means only when they reach or stabilize until years after skeletal maturity. That means when much later in life. Okay, that means when they grow up or when they reach skeletal maturity or years after that also, maybe, probably. So yes, so that means much later in life. Okay, and that is when the blood supply will become stable. Okay, until then it does not. Okay, and that is why your answer is B. So I'll just highlight that part of the answer. Okay, so I hope that is clear to you. Yes, exactly, Chinju Prasad. Yes. Right. And so now moving on to the next question. Okay. So now the question is, in the fifth paragraph, which of the following statement about blood supply to the femoral head is not mentioned? Okay, again they're asking for something that is not mentioned or not true or false or incorrect. Okay, just highlight that part of the question whenever you see that, or circle it or underline it. Okay. So yeah, and then now you can read the paragraph. I'll give you a minute to read it by yourself. Okay, so let's just read this. The blood supply to the femoral. Head has been studied extensively and has been found to change substantially during development until the cartilaginous growth plate forms a barrier at the age 4 years. The major blood supply comes from the medial and lateral circumflex arteries, metaphyseal arteries, which arise from the deep femoral artery. After age 4 years, the posterior superior and posterior inferior arterial branches of the medial femoral circumflex bypass the growth plate and form the main blood supply to the femoral. During adolescence, the growth plate fuses and the metaphyseal vessels again become significant, traveling along the femoral neck. Fractures in this area can disrupt this delicate blood supply, leading to AVN and the most severe complication of this fracture. Okay, so the question was what is not mentioned? Okay, and options are there have been a large number of studies into this topic. B, a significant development in this area occurs during adolescence. C, there is a significant change in infants aged 4 years. And option D, metaphyseal vessels are significant only for infants aged less than 4. Okay, so what do you think is the correct answer? Okay, let's look at A. There have been a large number of studies into this topic. Is that true? Yes, it is true because as per the first part of the paragraph, it has been studied extensively. That means there have been a large number of studies into this topic. So option A is correct and is mentioned. And what about option B? A significant development in this area occurs during adolescence. Okay, I can see a lot of you giving the answers. Jenny Franny has put in D as answer. Rahul Raj has put in D. Shruti Paravur Satish has put in D. Leju K. Nair has put in D. And Chinju Prasad has chosen D. Okay, so yes, and let me continue with the discussion as also that is we have told that A is definitely mentioned because it has been studied extensively. That means a large number of studies have been conducted on this topic. Option B, a significant development in this area occurs during adolescence. Yes. So is that mentioned? Yes, that is also mentioned. Okay, because definitely they have mentioned something that is happening, a development happening during adolescence. Okay, so that is during adolescence, the growth plate fuses and the metaphyseal vessels again become significant, traveling to the femoral neck. Okay, so that is something, a development, okay, that has occurred during adolescence. So moving to option C, there is a significant change in infants aged 4 years. Is that mentioned? Yes, that is also mentioned because they are telling that yes, until the cartilaginous growth plate uh, forms a barrier at age 4 years, the major blood supply comes from the medial and lateral circumflex arteries, okay, which arise from the deep femoral artery. Okay, so they are saying that until the cartilaginous growth plate forms a barrier at age 4 years. So what happens at 4 years? That cartilaginous growth plate forms. Okay, so that is something forming at 4 years. Oh, okay. So A, B, and C is clearly mentioned, and the only option that is not mentioned is D. Okay, so I hope this is clear to you, and congrats to all those who have answered D. So moving to the next question and the paragraph. And the question is, what do the statistics in the sixth paragraph reveal? And this is the paragraph. I'll give you a minute to read it silently and then we'll discuss. So for all those who have joined in now, I have given time to read this paragraph and come up with your choice of answers. Okay, so now let's read it together. So an estimated 340,000 hip fractures occur each year. Estimates indicate that in 2040, approximately 5 lakh hip fractures will occur. 9 of 10 hip fractures occur in patients aged 65 years and older, and 3 of 4 occur in women. White females have been reported to be twice as likely to fracture their hips than black and Hispanic females. This frequency has been associated with the metropolitan setting, increased caffeine use, alcohol use, sedentary lifestyle, psychotropic drug use, and senile dementia. So that was what the paragraph was about. And the question is, what do the statistics in the sixth paragraph reveal? Okay, so what do you think is the answer? Um, Right. Okay. So option A, a disproportionately high number of elderly women are affected by hip fractures. Is that true? Yes, definitely. They are saying that approximately like 9 of 10 hip fractures occur in patients aged 65 years or older. That means older patients are affected, and whether it's women, and 3 of 4 occur in women. Okay. So that is mentioned, and because of which your answer is A. 9 out of 10 hip fractures occur in patients aged 65 years and older, and 3 or 4 occur in women. That means it occurs largely in older population, and a high number of elderly or women are affected out of which. Okay, so because of that, we can say option A. Okay, and if you inspect B, C, and D, you can see that that's false, because B says the number of hip fractures rises by over 340,000 each year. No, that is not true. What they have mentioned is an estimated 340,000 hip fractures occur each year. Okay, so it doesn't rise by 340. Okay. At least like, or an estimation of 340,000 occurs every year. Okay, that means the next year it could be 3 lakh 50,000, or before that, or 3 lakh 30,000. Okay, it's approximate figures. Okay, so it's not a rise in number. What do you mean by rise in number? That means in the first year it's 3 lakh 40,000, so again a rise of 3 lakh 40,000 means the following year it should be 6 lakh 80,000. No, it's not like that. It's not a rise or an increase of that much of a number. Okay, it's just an average estimation of every year. Okay, and that is why B is not correct. And C, the rise in hip fractures affects all ethnic groups equally. No, because they are saying that white females are reported twice as likely to fracture their hips than the other kind of population, which is the black and Hispanic females. Okay, so that means it does not affect all ethnic groups equally, because there are differences. Okay, and also hip fractures, option B says, can be said more quickly in metropolitan hospitals. No, there is nothing like that. Okay, so it cannot be set more quickly in metropolitan. There's nothing like that. They are saying something else, that is the frequency has been associated with metropolitan, not about how to like fix or set the hip fractures in those settings. Okay? So that is not what is mentioned. So that is why you can eliminate B, C, and D and come in, and which will lead to option A being the answer. I hope that's clear to you. So now moving on to the next question, and the paragraph is, yeah, what do we learn about hip fractures in the seventh paragraph? Okay, and this is the paragraph. I'll give you a minute to read it, and then we'll discuss it. Okay, so I can see you're coming up with answers. So we'll read it now. Patients with hip fractures may present in a variety of ways, ranging from an 80-year-old woman reporting hip pain after a trivial fall to a 30-year-old man in hemorrhagic shock after a high-speed motor vehicle accident. Stress fractures usually manifest more insidiously, with an otherwise healthy person reporting pain related to activity and not healing with the conservative treatment suggested by their primary care doctor. Although the classic presentation of a hip fracture is an elderly patient who is in extreme pain, a young healthy athlete usually has the same presentation. The affected leg is externally rotated and may be shortened. The extremity shortening occurs because the muscles acting on the hip joint depend on the continuity of the femur to act. When this continuity is disrupted, the result is a shorter appearing leg. Assessing peripheral pulses and checking Doppler pressures to assure vascular patency is very important. So, and the question is, what do we learn about hip fractures in the seventh paragraph? And the options are A, stress fractures are more difficult to detect than ordinary fractures. Option B, 30-year-old patients have a better likelihood of recovery than patients over 80. Option C, primary care doctors may suggest painkillers rather than treatment for fracture. And option D, in some patients, contorted leg muscles may make stress fracture diagnosis more difficult. So, what do you think is the answer? Okay, so, right. So, the correct answer for this option is A. Stress fractures are more difficult to detect than ordinary fractures. The reason being, look at the sentence. Stress fractures usually manifest more insidiously. Okay. Okay. So, what do you mean by insidious? Okay. What do you mean by manifest? Manifest means to make evident. Okay. So, that means stress fractures usually appear or make evident, that is manifest more insidiously. What do you mean by insidiously? Insidiously means that is gradually or secretly. Uh, is what insidious means. So that is basically causing harm in a secretive way. In a secretive way. Because that means it is difficult to detect or see, witness. Okay, so what does that mean? So stress fractures usually, what do you say, appear secretively, okay, and cause harm. What they are actually hinting at. And that is why your answer is A. Stress fractures are more difficult to detect than ordinary. It's difficult to detect. Okay, so, and that is why your answer is A. Okay, so moving on to the next question. Right. So, yeah, I hope you can see this. The questions which are the following is not mentioned in the last paragraph. We'll just highlight that part which is asking you for not something that is not mentioned. Okay, so three of them are mentioned. Three of the options are mentioned. So I'll give you a minute to read this and come up with your choice of answers. Okay, so let's read this. The patient with a stress fracture may present more subtly, reporting pain in the anterior groin or thigh. This pain increases with activity and can persist for hours afterward. The pain can progress to a point of consistency even without activity. This pain generally expresses itself in the groin. However, it can also be referred to in the knee. An antalgic gait pattern is often Present signs and symptoms usually involve a diffuse or localized aching pain in the anterior groin or thigh region during weight-bearing activities that is relieved with rest. Night pain is also common. A study by Brandstorm et al. That included 4 lakh 8,000 older adults reported an association between antidepressant medication and hip fracture before and after the initiation of the therapy. Future investigations are needed to study this association. So that was what the paragraph was about. And the options are: A, the location of a pain is an important factor in correct diagnosis. B, nocturnal pain can be symptomatic of a stress fracture. Option C, pain duration should be taken into account. Option D, antidepressant medication can relieve some symptoms of stress fracture. So those are the four options. So what do you think is the correct answer? Okay, so let's inspect each of the options. A, the location of pain is an important factor in correct diagnosis. Yes, definitely that is mentioned, because they have mentioned that yes, the pain increases with activity and can persist for hours afterwards. So yeah, so basically where it happens, the location is mentioned here. Okay, so yeah, so where this happens, or the knee. Okay, so all these information is mentioned here. Again, it is mentioned here, the location is mentioned here. Okay, and then moving to option B, nocturnal pain can be symptomatic of stress fracture. Yes, that is also mentioned, because night pain, that is nocturnal pain, is also common, that we have mentioned. Moving to option C, pain duration should be taken into account. Is that mentioned? Yes, it is also mentioned, because see, they have mentioned that it can persist for hours afterward. Okay, that means the duration of pain mentioned. And option D, that is the answer that is not mentioned. That is option that is not mentioned. Antidepressant medication can relieve some symptom of stress fractures. No, that is not mentioned. What they have mentioned is some some people or older adults have reported an association between antidepressant medication and hip fracture, but further investigation are needed to study this association and confirm it. So it's still under investigation, so you cannot give a confirmation that it can relieve some. No, some have reported association, but that is still under investigation. So if you say that it can relieve some symptoms, that is incorrect. Okay, you cannot confirm something that is still under investigation. Okay, and that is why the correct answer for this question, that means the information that is not mentioned, is option. Okay, so with that, we are coming to an end of the reading module discussion, and so now it's time to wind up. So I hope you have understood whatever we have mentioned today or discussed today, and I hope you have got an idea how to approach part C. So thank you for joining us. See you next week, and take care.